And I'll go ahead and let them in. And it looks like we have one more person coming in now.
Okay.
There we go. Great. Well, welcome everyone. We're really excited to have you here. Today's session is an information session for pediatric primary care nurse practitioner programs. My name is Michael Walker. I'm a director of admissions here and will be a great point of contact for you throughout the application process and as you're gathering information. We have a very special guest with us, Dr. Jeannie Rodriguez, and I'm going to go ahead and hand it over to her so she can introduce herself and also, talk about this wonderful, wonderful program.
Thanks so much, Michael. Welcome, everybody. I'm glad you're able to join us today. And if you're not, that you're able to view this online at a time that's convenient for you. So as Michael mentioned, my name is Jeannie Rodriguez. I'm the director of the Pediatric Primary Care Nurse Practitioner Program. I've been here at Emory for about 10 years. Actually, a little bit longer than that, but been kind of full-time here at Emory as a faculty member for about 10 years. I'll just tell you a little bit about myself before we talk about the program. I've always been a peds person. And even in nursing school, I remember all my friends were excited about working like in an adult ER and an ICU. And I'm like, I just want to be with the little people. So I was always kind of where I wanted to be. And my first nursing position was at Children's Healthcare of Atlanta, which is here in Atlanta. I worked at the Eggleston campus for many years as an RN on the floor. I worked in a vent pod, which is now known as a technology-dependent ICU. So I worked with patients who were ventilated, had trachs, lots of extra care that were required. Occasionally got to float out to the general pediatric floor, but mostly kind of did that specialty care as a nurse. And then I worked for a little bit as a nurse in a primary care office and found that I really liked what they did there. I enjoyed getting to know those families and the people that work there in the office and just the type of work that we did. And then I went back and got my master's degree at Emory. Actually did that here at our School of Nursing, and then became certified as a pediatric nurse practitioner. And I worked in that role for several years at various places around Atlanta, always in primary care. Just really like that continuity that you get with families. And then eventually went back and got my PhD. I did that at University of Alabama at Birmingham. And then after I finished that, I came back here to Emory full-time as an assistant professor. Now I'm at the rank of associate professor. And so I get to kind of direct this program, which is just such a joy and a privilege to be able to do that. I work with some great peds faculty who are really passionate about children, and I think that really comes through to students, and just enjoy that role. So I'm going to talk about our PEDS program with you all. So let me see if I can share my screen. So give me just a second to do that and get that all set up. Let's see, and I know you're just looking at my Zoom background right now. I've got to start my slides. And let me switch my display. Okay, so you should be looking at my intro PowerPoint about the PNP Primary Care Program. So we'll get started. I'm actually going to begin by talking a little bit about the role of the pediatric nurse practitioner in primary care settings. So our job is to treat children and a little bit of their caregivers as well from birth through the transition to adult care. So it varies when that happens. For some people, At 18, they move over to the adult care system, but others hang around with us a little bit longer. Maybe they go through college. Sometimes we have kids with special health care needs as well, that the transition is going to just take a little bit longer. But definitely from birth all the way up through kind of young adulthood is the age range that we have. A PNP in primary care can actually work in a variety of settings. Most probably do work in a primary care pediatric office, so that's your typical pediatrician's office or pediatric office within your community. But we also have graduates that work in public health settings. So some work at like the CDC. We've had others that have worked at health departments. Some work in school-based clinics that hire nurse practitioners to deliver care in those clinics. And we have quite a few of our graduates that end up in subspecialty practices. So that's like your pediatric cardiology or pediatric ENT, variety of subspecialties that are available for you to work in as well. So what does a PNP in primary care do? So you perform pediatric health, several things actually. You do perform pediatric health care maintenance. So that's usually like the checkups or well child exams. A big part of that is looking at how that child is doing developmentally, and then doing an in-depth physical assessment of that child. So it's a lot of screening, a lot of making sure that they are well, and if they're not, can we optimize their health, right? So doing a lot of that type of work. We also do a lot of back to school physicals, and that includes sports physicals. I don't know if any of you were involved in sports maybe when you were in high school. So we do a lot of those sports physicals as well, and then provide all the immunizations to children to keep them well. We do diagnose and treat childhood illnesses, some of which are just kind of run of the mill childhood illnesses. Others can be more urgent or emergent type illnesses as well. What happens is our patients get to know us, right? Because they've seen us since the time they were born. And when they get sick, they want to go someplace where they know the people. And so they end up in our offices. And I've had kids walking, the parents kind of helping them walk down the hall because they're having this terrible asthma exacerbation or asthma attack. We get them into the room and we do some initial treatment of them, but our goal is to kind of get them out into the ER and admitted to the hospital for further care. So you'll see a good variety from well child to sick kids. And a lot of times too, those are children who are chronically ill. What I say about pediatric primary care that's different than hospital-based care or subspecialty care is that most children are never hospitalized. Small segment of them are hospitalized, and a small segment of them need to see the subspecialist. Everybody needs to see the primary care provider, right? And we have continuing relationships with that child and that family from birth all the way into young adult years. So we will see children who have chronic illness. We'll see children who are perfectly well. We'll see children when they're acutely ill, right? So we see everybody. So you really have to have a good breadth of knowledge to be able to do that. We're the ones that when a child comes in and they have signs and symptoms associated with type 1 diabetes, we're the ones that figure that out and then send them to that subspecialty in endocrinology to kind of firm up that diagnosis and then develop a management plan specific for diabetes. But that child with type 1 diabetes still has to be seen by you, the primary care provider, because an endocrinologist is not going to diagnose them with strep when they get strep, is not going to be able to know the routine vaccine schedule to give them their routine vaccine. So they still will need to see you, even though we're co-managing them with a subspecialist for their chronic illness. We also spend a lot of time providing parents with advice about typical childhood concerns, talking with them about nutrition, about weight management, about a lot of variety of things. So a lot of what we call anticipatory guidance for the families. We also provide a fair amount of behavioral counseling. I think we've always had issues with mental health in children and adolescents, but certainly the COVID pandemic accentuated that even more. So we're having higher rates of kids with mental health problems right now. And we do a lot around screening, diagnosing, and managing those mental health issues. So that's a big role in primary care. I'd say probably about a third to half the children that come in have some sort of mental health concern that you end up helping with. When I was trained many years ago, we would have patients come in, we would do screening, and then we would refer everyone out to a mental health specialist. But unfortunately, in pediatrics, there's really not enough mental health specialists. So we and primary care have had to take on a bigger role there. So not only do we screen children for mental illness or mental health concerns, but now we're diagnosing them and we're initiating treatment and sometimes maintaining treatment over a long period of time. And then depending on the mental health concern, we may also be co-managing them with someone in psych mental health. So we do a lot of work around that area. We also provide a lot of guidance for families around safety, sports injuries, all sorts of topics. So hopefully that gave you a little bit of an overview of what a PNP in primary care does, which the answer is just about everything. You really have to have a big kind of tools, lots of tools in your toolbox to be able to do this. So again, a lot of breadth in our training here. So let me talk about our training at Emory. We offer several program options. So the first is our DNP program. So a DNP prepared primary care nurse practitioner practices at the kind of the highest level of pediatric nursing. So they are considered the pediatric clinical expert. They are able to do a lot of what I just talked about, kind of in the clinic management day to day, seeing one patient at a time. But in addition to that, a DNP prepared primary care pediatric nurse practitioner kind of takes a look at their entire clinic population and recognizes and evaluates those population health problems. So let's say that I'm working in a primary care clinic and I notice a lot of my patients are children with special health care needs. And I also notice that the care that we're delivering in the clinic isn't truly coordinated care or collaborative care. And I feel like we really need to work on that area. So I'm going to, as a DNP prepared person, recognize that's a problem within my community, within my clinic population. And I'm going to go look at the literature. What does the literature say? What are some good interventions that we could do in our primary care clinic in order to ensure that these kids get the best possible care? And then I'm going to take all that literature, I'm going to synthesize it and develop an intervention or maybe a set of interventions as a program to address that problem within my primary care clinic. And I'm going to implement it. And then I'm going to collect data. Did that work? Right? Were there certain elements of that worked and certain elements that didn't? Are there certain things we want to continue, or do we want to kind of augment what we were already, what we had done within the program, and maybe add other aspects? Once we get that really fine-tuned, it's then my job to go and inform the rest of the healthcare community through presentations and publications and say, hey, this is the problem that we noticed in our clinic. This is the solution that we came up with, which was nice evidence-based solution from the literature. And we implemented this, and this is how we improved care for children with special health care needs. That's what a DNP prepared primary care pediatric nurse practitioner can do. And that's what you're trained to do in a DNP program. The MSN prepared primary care pediatric nurse practitioner does the things that we just talked about, right? The earlier things that we talked about, where they see patients one at a time and they manage that individual patient's care. It's only at the D&P level that you're prepared to do this stuff that we just went over on this slide. So hopefully that differentiates in your mind what an MSN prepared primary care pediatric nurse practitioner can do versus what a D&P prepared primary care nurse practitioner can do. So we have what we call Team Peds here at the Emory School of Nursing. So I work very closely with all of our pediatric colleagues to be able to kind of deliver a top-notch education program for you. So I direct the pediatric primary care nurse practitioner program. Dr. Anne Marie Brown is our PNP acute care program director. We also have on faculty Stacy Buchanan, who's a wonderful DNP prepared PNP, who's worked in primary care for many years and in peds urgent care as well. Dr. Buchanan really focuses for some of her scholarly work on vaccine hesitancy and vaccine promotion. So you may have seen her kind of out in the community doing some work around that. Sharon Close is one of our PhD prepared faculty. Sharon is a very dynamic faculty member. She has an active area of research where she's been kind of federally funded. And a focus for her is around care of children with genetic conditions. And she actually was a co-founder of a genetics clinic here at Emory, where she works with children with X and Y chromosome disorder. So we have great expertise around genetics here at the School of Nursing. Lori Modley is another faculty member, and Lori is a very dynamic faculty member. She and I partner together a lot on delivery of primary care to refugee and immigrant populations. Lori also kind of heads up clinical practice in one of our big immersions that happens at Emory, where we go to Moultrie, Georgia, and work with farm workers there. So Lori has the opportunity to do that as well. And then she also works with our NEST program. The NEST program here at the School of Nursing offers additional support to students as they go through our program. And that can be study support, it can be academic support. So they kind of help shepherd you through the program when you need that extra hand. Teresa Kiplinger is another faculty member that works closely with us. Teresa really focuses a lot in our health assessment program. She and I have really kind of redone that program, and she helps us deliver that content. She is an acute care pediatric nurse practitioner that works at Children's Healthcare of Atlanta and works with the surgical team. She recently actually moved from CHOA to Northside and currently works with this kind of new team. They're just starting where they're going to be doing surgeries on babies coming that are in the NICU. So a lot of ex-preemies or preemies. And she'll kind of be part of that surgical team, and that's really her clinical focus in our program. So happy to have such a great diverse faculty that really add to your education. So a little bit about our programs at Emory. So we do offer an online program with on-campus intensives. And what that means is that throughout the semester, you access your courses online and kind of go through some synchronous and asynchronous modules online and learn about different aspects of pediatric advanced nursing. We have once or twice a semester where you come to campus and do intensive experiences with us. And typically those are maybe 2 to 3 days long. We do a lot of simulation, a lot of labs, a lot of hands-on seminar and labs that we do to kind of make sure, checking in with you to make sure you're where you need to be, but also kind of augment your education where we can actually do some hands-on work together. So the online program with intensives includes core courses. So you still have to take advanced patho and advanced pharmacology, but we also have pediatric specific courses that you take as well. We do offer some live online pediatric specific seminars that are part of those lecture courses. And then the on-campus intensives that I talked about earlier, which include a lot of simulation and lab time and some seminar time as well. In addition to that, you have clinical experiences that you get. So we use what's called a preceptor model in our post-licensure programs. And what that means, it's a little bit different than probably what you did in your pre-licensure or undergraduate nursing program, where you went as a group of maybe 6 to 8 students out to a hospital setting or a community setting. And together as a group, you were maybe individually assigned a patient to take care of that day, but you were there as a kind of a cohort, as a group. What we do that's different is that you are assigned to one preceptor, just you and that preceptor, and you basically work with them, work their shift or their hours that they're working in the clinic for your clinical experience. So it's really one-on-one clinical training. So we have 2 programs here at Emory for the P&P primary care program. The first is an MSN program, and it includes a minimum of 780 clinical hours. And then our DNP program has more hours on top of that. They do a total of 1,140 clinical hours. All of the clinical hours are specific to pediatrics. So you don't do anything with older adults or other population groups. We really focus on pediatrics. We do kind of have a rule in pediatric primary care that at least half of your hours needs to be in a primary care setting. That is your specialty after all, but you are able to work in specialty practices as well, or do clinicals and specialty practices like cardiology or pulmonology if you're interested. So I already mentioned what we do one-on-one precepted clinicals. We have preceptors that are PNPs and MDs or DOs. Occasionally we do work with some PA colleagues as well. There's just a little bit of extra work because their license is tied to the physician as opposed to having an independent license in most states. But that is kind of how the clinical training works. So I think I'll pause there and see if there are any questions from anybody in the group. And you can feel free just to unmute yourself, or if you'd like, you can type questions in the chat. And if there aren't any questions, I have kind of common questions that I'm asked that I can go through as well. But I'll pause to see if anybody wants to unmute themselves or type in the chat.
Hi, my name's Elizabeth, and I have a question about finding preceptors. So you're saying that you have a group of preceptors already, I guess, designated. So I've heard with other programs that it can be very difficult to find preceptors. So is that something that the program helps us with or pairs us with other preceptors? How does that work?
Yeah, it's a great question, Elizabeth. So at Emory, we have kind of a partnership that we do with students. So our goal is that you find placements, or we work together to find placements that are close to where you are and that you are interested in doing. And one of the best ways to do that is have you actively involved. So what we ask is that you begin kind of a preceptor search. And we have a whole clinical collaborations website that we have that really directs you on how to do that. But it's a lot of kind of reaching out to different practices right where you live or that you're interested in working with, touching base with them, talking with them about who you are, sending your resume, having a conversation about what precepting would look like in a given semester. So we start with that process. And then we kind of keep in touch with you. So our clinical placement team is, we work with Tamara Jacobs. So Tamara routinely meets with you all at least once or twice a semester. That can be online or that can be in person. Sometimes she shows up at intensives and does a lot of emails with you back and forth about how things are going, anything she can do to kind of help. And we have a whole site on our clinical collaboration site, a whole section that's devoted to a list of people who we already have existing contracts with, that we have precepted with before. So you have access to that list. So you can access that list and kind of work through that list, as well as the practices that are around you. If you're having no luck and things aren't going well, that's when we do a touch point, right? And we'll meet and kind of discuss where you live and talk about maybe some additional contacts that we have in that area that you can reach out to. At the end, when students aren't able to find clinicals, we do have some people that we work with regularly in the Atlanta area that we can try to plug you in with. And then we also use a third-party vendor that we work with to try to get you placement as well. So it's really a true partnership. I've directed this program for several years now. It is hard to find preceptors. I won't lie about that. It's a lot of legwork, a lot of emails, a lot of touch points, calling the office managers on the phone, talking with them. So it is a lot to do and a lot of work, but we've had really good success having you do some of that legwork up front and really kind of looking for a placement that's right for you. And if there's no luck, then kind of partnering with us to kind of look at in other directions, look in other places that we may have other contacts in, and then kind of backing you up at the end. I've never had a student that started a semester without a clinical site before. Not saying that would never happen, but we really work hard to ensure that that doesn't happen.
Okay, thank you.
You're welcome.
Yeah, and I did put a link in the chat to the Clinical Collaborations website, so you can get a chance to take a look at that. And for those who are viewing the video, if you Google Emory School of Nursing Clinical Collaborations, it should pop right up.
Right. And that website is great. It's got multiple pages on there for you to kind of look through. And it even has like a suggested template for you to use for your email when you reach out to people. Like I said, it has a whole list of preceptors and practices that we have contracts with that you can kind of tap into to review. So it really gives you a lot of guidance on how to kind of partner with us to be able to find the preceptors that you need. Any other questions?
Hi, I have a question.
Okay.
For those of us planning to start the program in the fall, when do you suggest starting the search for a preceptor?
So, Caitlin, are you thinking about an MSN program or a DNP program?
DNP,
DNP. And were you thinking full-time or part-time?
full-time.
Okay, so thanks for answering those
Mhm.
questions. So for our DNP program, it does start in the fall semester. And if you are a full-time student, you will not start clinicals until the summer semester. So if you plan to enter fall of 2026, which just doesn't sound right when you say that date, but that if you plan to enter that, I can't believe that's going to be 2026 soon. If you plan to enter fall of 2026 as a full-time DNP student, you would not start clinicals until summer 2027. If you were a part-time DNP student, you would not start clinicals until summer of 2028. So my advice would be that you start looking. So if you're going to start in the summer, my suggestion would be that you begin your search in the fall semester. We really have a goal of having secured placements by mid-spring semester, or the midpoint of the semester before you start clinical. So in the DNP program, since you start in the summer, our goal would be the spring semester right before that, that halfway through that semester, we have secured a site. right? And we have everything in place. So you just roll into the summer and your first clinical semester, really easy to go. Okay. So for the MSN program, I'll go ahead and talk about that as well. If you start full time in the fall, then you would start clinicals in the spring semester, so that next semester. So for you, it's probably not a bad idea that sometime late in the summer, you start kind of reaching out to some potential preceptors. And again, the goal would be by midpoint in that fall semester that we have worked hard with you to kind of secure a site. So again, you roll into that spring semester ready to go.
Got it. Thank you. And just to clarify, so those first 2 semesters then, so the fall and then the spring semester, that's when like those intensives like on campus would be happening, or are those intensives also happening like all throughout the program as well?
So it's a good question. So, and let me see if I can click on this link because it's a little bit easier to explain it with a visual aid, I think. So let me go back to Zoom and share my screen. So we'll look here. This is our DNP program. And this is for Pete's primary care, and it is the full-time program. So you would start in the fall semester and you would take a lot of core classes for the DNP. So it's your advanced patho, your advanced pharm, person-centered care, and design and methods. None of those have an intensive. And then you roll into the spring semester where you have advanced health assessment with a pediatric focus, this knowledge for practice, which is like, what's an APRN? How do I do that, right? What do all those terms mean? And then population health. So again, some core classes. The only one with an intensive is this advanced health assessment course. And that intensive is twice a semester. So we typically have you come in for 2 days about midpoint, and then we come in for maybe, I think it's 2 to 3 days at the end, towards the end of the semester. And then in the summer, you again have some core classes, evidence-based practice, quality and safety. And then you pick up here with your pediatric specific courses. This pediatric NP practicum is where your clinical hours are. So that's when you start clinical, like I talked about earlier. But this pediatric NP1 does have intensives associated with it. Summer is a weird semester. So typically our semesters are 15 to 16 weeks long. Summer is only 12 weeks. So we only have you come in once for an intensive here in the summer. You don't have intensives with these evidence-based, these core courses. And then we kind of roll into the fall. Again, you have some core courses, but the PED specific courses, you'll come in twice for intensives here. And then after that, you're really just coming in once for intensives. And it's really associated more with the PED specific courses.
Got it. Thank you.
You are welcome. And I'll go ahead, in case there are some people interested in MSN, and show you that, which looks a little bit different. So for the MSN, you really start intensives right away. So you'll start in the fall. This is the fall start, which is the full-time start. So you have your health assessment course, and then another specialty course called Diagnostic and Clinical Reasoning that's for PED specific, along with these 2 core courses. So for the MSN program in the fall, you do have intensives twice during that semester. And what we do is we combine health assessment with diagnostic reasoning for the intensives. In the beginning part of the intensive, you're in health assessment. And then the second part of that intensive, you're doing content related to diagnostic and clinical reasoning. So it's typically will meet about midpoint on campus and then towards the end of the semester. And typically there are like 2 to 3 days each for each intensive. And then in the spring is when you have some core courses that do not have intensives associated with them, but you do have your pediatric specific course. So this is your clinical practicum where you're doing your clinical hours, 180 hours starting in the spring. But your didactic course does have an intensive associated with it, and you do come in twice for that. But then starting in the summer, you only come in once for the summer and once for the fall. That was a lot of information. Hopefully that was helpful. We do have part-time options for both a DNP and the MSN. The MSN part-time you can start in the fall or in the spring semester. The DNP only has a fall start for part-time or full-time. And thanks for adding the links in the chat, Michael, if you're interested. And I do recommend, whether you choose Emory or another program, always go in and look at what that program of study will look like for you, so you get a good sense of what types of classes you're taking and where they're happening. Any other questions? So I will talk a little bit about kind of some commonly asked questions that people usually ask me. So a lot of people want to know if they can work while they're in the APRN programs here at Emory. And the short answer is yes, you can. What I always tell students is if you are going to be a full-time student and work full-time, you are basically committing yourself to have 2 full-time jobs, which means you will have 0 downtime. You will kind of have time to sleep, but that's about it. You'll either be at work or you'll be doing school stuff every day. It's very intense. And that's whether you're doing an MSN or a DNP. So a lot of students will start their program full-time, right? Full-time student, full-time working. But usually after about a semester, they'll say, woo, I really need a minute, right? Like this is a lot. And I will say, yeah, I know it is really a lot. And so they'll usually drop back maybe to part-time at work. Some will choose to drop back part-time for school, and that's fine. Once you're here, we want you to stay. And so we will do our best to work with you and help you work through that. The reality is a lot of people have to work to eat, and that is a priority and is important. So if that's you, that's okay. We can slow down your program so that you can do that. We want to work with you and ensure that you're successful in the program and learn the information that you need to learn. So working is a possibility. The further along you get in the program, whether you do a DNP or an MSN, the more clinical hours you will have to do within the confines of a given semester. And a lot of people end up kind of dropping to, at the end of their program, will drop to PRN. Some will even just quit working and just finish out the program, especially in the last 2 semesters. You have a lot of clinical hours, particularly in the final semester. It's 360 hours in the final semester, whether you're an MSN or a DNP student, and that will feel like you are working there. Students are there 3 and 4 times a week, so it gets increasingly more difficult to work a full-time job when you're doing that. Any other questions about working? we actually designed our part-time options knowing that a lot of people would still want to work and find value in that or just need to do that. So part-time options are available if you want to work or need to work. And I'd encourage you to look at those and consider those. You want somebody, when I was in my PhD program, I remember a fellow student saying to me, I'm in this program, I committed to this program, but I'd like my family to like me when I finish and still want to be around. And so they kind of took a slower path in order to do that and just kind of have a good quality of life. So you can certainly do a full-time program and have a good quality of life, but you should also consider whether part-time might be right for you. And either one, no matter what you choose, we're here to support you, and we have great support here at the School of Nursing. I mentioned Lori Modley works with our NEST program. They actually have graduate teaching assistants who are in some of those big core classes to help you through patho, doing supplemental instruction sessions with you, meeting with you one-on-one for tutoring if needed. And so we're here to ensure you're successful. And we have programs like that at Emory to help you through that. Another question that commonly comes up is for those who are considering doing a PNP program, but they don't have a lot of PEDS experience, or maybe they don't have any PEDS experience. They're going straight into the PNP program. They'll oftentimes ask me, will I be able to find a job as a PNP when I graduate if I do that? And the answer is yes. We've had good success with students who have done that. So remember that a hiring manager in a primary care clinic is usually either a physician or an office manager. And so they are oftentimes thinking about a medical model or a PA model. A medical student doesn't go through med school and then go and work as a medical student for a while, right? That's strange. So they go straight through and finish. PAs kind of do a similar route. We're the only ones, I think, that get that RN and then can go and practice for a while before we go back to be an advanced practice person. So oftentimes, a hiring manager or hiring physician won't even think that's a problem. So I always say your first job doesn't have to be your dream job. Sometimes it is, but maybe that's just a first stepping stone for you. And as you get more practice and experience as a nurse practitioner, you'll be able to move to your dream job. The other thing I'll say too is that the work you do as an RN, even if you're working in a pediatric hospital setting, the work that you do as an RN is very different from the work that you do as a PNP in a primary care setting. Even the way that you think about the information you're receiving from a person is very different. And so those skills that you learn as an RN working on a floor, you don't do many of those skills as a PNP working in a primary care clinic. It's a different skill set. You're certainly doing very advanced nursing, but you're thinking and doing things in a very different way. It's a very different role. So I think that while you will learn things working as an RN that will help you as an NP, it's not a requirement. And students do well in our program, even without experience, and they do get jobs afterwards. And I'll pause for a minute to see if there's any other questions about that.
Speaking of jobs, because that's
Mhm.
obviously a very important factor, what percentage of your students have a job secured at graduation?
Yeah, there are some that do. So I would say maybe a quarter of the students have a job secured by graduation. A lot of our students who don't really haven't started looking. So like we have a group graduating in December, both an MSN and a DNP group. And I've been talking with a lot of them about that. And they have so many clinical hours and demands on them in the last semester that they're like, I just want to get through the semester and then I'll think about my job search. So some people just choose to wait. Some people put feelers out there, but they're not like intensely working. Others, the ones where they typically are employed before they graduate, oftentimes it's because they have worked very hard throughout their program to develop strong relationships with the clinical practices and the preceptors that they've been working with. Throughout the program. And oftentimes they'll get job offers before they leave the program because they've left such a big impression on the preceptors and the practices where they've been doing their clinicals.
Okay, so do you feel like most students will then have a job within a year of graduation?
Oh, yeah.
Okay.
Yeah.
That's
For sure. Yeah, within a year.
because I know it can take a moment to become licensed as well.
That's absolutely true. So the way it works is you have to have a degree before you can even sit for your certification exam. And we graduate everybody, whether you're part-time, full-time, MSN, or DNP, all of our students graduate in December, and we graduate, like this year, we graduate December 12th. So that hits right up on the break time. So it does take the university a minute to kind of send out an official transcript with your degree listed. And the boards require that official transcript with the degree listed before they'll allow you to sit for your PNP certification. So because that takes a little bit of time, you're oftentimes not given approval to even register for a date until maybe early January. And then you have to take the certification exam. And then once you do that, depending on the state where you're working, you have to either add an advanced practice to your RN license or get a separate advanced practice license in addition to the RN license within that state. So you're right, Elizabeth, that process just takes some time. So typically students are, even if they are very diligent and want to take that exam right away, they're oftentimes not really eligible to start a position, I would say, at the earliest, maybe mid-February.
Okay, thank you.
Yeah, sure. It's a good question.
And Dr. Rodriguez, can you talk a little bit about the work that the Career Management Center does to support students through that process?
Yeah, that's great. Thanks for bringing that up, Michael. So we do have a career management services office. We work a lot with them, actually. In fact, Andrew Plush, who's kind of over that office and works in that office, does a whole session for us in the last semester on building your resume, on doing an interview. So he does that for all of our students who are getting ready to graduate. In addition to that, he offers that service in your last semester. You can come and meet with him individually. You can send him your resume and the team that he works with, and they'll look over it. They'll meet with you. A lot of people have anxiety around doing interviews, so they'll meet with you and do mock interviews and practice interviews. He has met with people after they've graduated too, if they seem to be having trouble. We'll tell you that doesn't happen a lot with our PNP students in primary care. But if you're having trouble, sometimes people will touch base with Andrew and say, hey, could you look at my resume again? It doesn't seem to be landing well. Maybe we need to work on the cover letter a little bit more, or the way that I'm reaching out to practices. And he really helps you a lot with that. Is there anything you wanted to add to that, Michael?
I would say that across the programs, there's also, well, a couple of things. He does organize on-site career fairs, and so he'll bring in healthcare practices and healthcare systems to be able to connect with our students. They are very eager to meet students from the #1 nursing school in the nation, so it's not a hard sell to get them to come. And I don't have the latest numbers, but we typically are hovering in the high 90% range within 3 to 6 months for our graduates to land roles. And part of that why it takes a little longer in some cases, and it's not immediate, is the licensing piece, because it just takes time for folks to sit and study, get that license and then be eligible to get hired. But they are a small but mighty office that has a huge impact. And I think it takes a lot of stress out of the job search process. So I'll say that, for those of you who are going to be part of the program here, I highly encourage you take full advantage of that as a resource.
Yeah, it's a free service. So they're here to kind of help you. So it's kind of part of the thing that I think you get when you come to a place like Emory. So yeah. Any other questions? Well, I'm very thankful that you came today. I hope the information session was helpful. I'm going to also put my email into the chat, and then I'll just say it as well, but I can't, it's hard to talk and type. So it's my name, it's jeannie.rodriguez@emory.edu. So I'm happy for you to reach out to me and ask additional questions. We do information sessions like this for a lot of different prospective student groups, and I typically get emails afterwards, so I don't mind at all. But happy to talk with you further, and we can even set up like a Zoom meeting one-on-one if you have additional questions that we can't answer by email. And then I see Michael's put an email address in there as well for the admissions office if you want to reach out to them. Sometimes I will say, if you have questions about the PEDS primary care program, then I'm probably a good person to reach out to. If you have questions about the admission process or about financial aid, I would say that nursing questions is a good place to start. You can always email me, and I'll talk to you about anything, but you're probably going to get me saying, you probably want to reach out to the admissions office about that question. So I'll always talk with you. I don't mind. But I think that hopefully gives you some direction about who to contact.
I'm going to make a shameless plug. So round 3 admissions deadline is actually coming up. It's December 1st. You actually still have plenty of time to submit that application. And so I would just encourage you, if you're thinking fall is great and Emory is great, go ahead and start working on that application. After that, we are going to be adding a round 4, and that deadline is going to be March 1st. I encourage you, if you could submit it now, go ahead and just get it out the way. You'll be excited to get a decision earlier rather than later. And again, if you have any questions about the admissions process, please feel free to reach out to us.
Absolutely. And I think one of the things that I want to emphasize too, that we really work hard on is, as faculty, developing that personal relationship with you. So as the director of the PEDS primary care student, I meet with every student in our program every semester. And we just kind of take that time to get to know each other. I kind of get a better understanding. So I have a student right now who is interested in primary care, but particularly interested in cardiology, right? And she really kind of thinks she might be heading in the subspecialty route, but loves her training in PEDS primary care and in the primary care office, but just thinks she might head that way at some point. And so we've really spent a lot of time together at those meetings talking about, okay, and she's a DNP student, so she's got lots of semesters of clinicals. So, okay, we want you to do all primary care in this first semester, but let's see if we can get you a cardiology rotation in the second and third semester. And maybe we want to even consider like a rotation in a fetal medicine clinic because she's particularly interested in congenital heart defects. And they detect a lot of those even before the baby is born. So we really spend a lot of time getting to know you and helping you tailor that program to you so that you can get to where you need to go. And I think that goes not just for me as the director, but our other faculty as well. They're very open to meeting with you. So I mentioned Dr. Close earlier, who works in the field of genetics. She's always willing to kind of meet with students who are interested in that area or just interested in kind of in subspecialty about what her career pathway looked like, and how do you really kind of get that additional knowledge within a particular area, right? And hers is genetics. So how did she get all that additional knowledge that she needed to work in a clinic that focuses on children with X and Y chromosome disorders, right? So she's happy to talk with you or anybody else as well about what their pathway looked like and giving you some suggestions for kind of extra learning opportunities. So I hope that was helpful. It looks like we lost Michael for a minute. Oh, here he is. So I hope that information was helpful. Again, you can reach out to me if you have any additional questions at jeannie.rodriguez@emory.edu. I'm happy to answer those for you. And thanks so much for being here today.
Great. Thanks, folks.
Thank you both so much.
Yes, thank you.
Absolutely. Thank you.